Welcome all to this Raising Anchor 2026 virtual session with a dear friend and colleague for many years, Mike DeLay. Mike has been a source of support, counsel, collegial effort, and someone that Hope Reform just has an extraordinary amount of respect and admiration for, to the extent that he was invited to opine and share his thoughts on matters pertaining to the wellness of our workforce and behavioral health. Raising Anchor is the virtual conference of Hope Reform that we host annually with speakers that lend their perspective and expertise from around the world. Hope Reform itself is a nonprofit accreditation and certification organization serving agencies that perform crisis services in community, and that those, to the extent that those agencies are reaching for higher standards, reaching for how to do things better, and in many cases in need of technical assistance, Hope Reform is there for them. You can learn more about Hope Reform by visiting hopereform.org. It's also something worth noting that this conference is something that is also an opportunity and an invitation for you to make a donation. Hope Reform is a nonprofit organization and charity, registered charity in the state of Washington, and a 501c3. And very often we're offering our technical services or our consultation at considerably reduced or no cost in the service of these agencies that need support. Today, I'm really excited to have this conversation. This is our third in the series this month with Mike DeLay. And Mike, welcome and thank you for taking the time to be here for this session. It's very appreciated.
Oh, happy to be here, man. I appreciate the opportunity to be a part of this.
Wonderful. Mike, for the benefit of our viewers and who are interested in this session today, perhaps you can provide a little context about your extremely hard-earned and robust professional background and experience that brings you to a place where people feel that you have something to opine that's worth listening to.
I thought I was supposed to tell the truth, man. No. So I've been in behavioral health work. This is my third career, and I'm very fortunate that it's been my longest career. I've been doing behavioral health work for somewhere in the neighborhood of 14, 15 years. I started off as a volunteer receptionist at a nonprofit mental health clinic while I was going to school. And I dug it. I enjoyed being there. I enjoyed the folks that were coming in, and had the opportunity to transition from that to a paid position as a homeless outreach specialist on a PATH project. Worked street level outreach, housing case management, transitioned from that into substance use disorder services. I got the chance to work on some really unique projects at the time. Some in-clinic traditional OP stuff, which I was horrible at. But then the opportunity came to provide those similar services inside houseless shelters, to provide services actually in encampments, which transitioned to providing services inside a county jail. So running substance use disorder services inside of a correctional facility, which is right around the time that I got the opportunity to start doing some crisis intervention de-escalation work.
Yeah.
And that opened the door to providing behavioral health support and housing first locations that were just starting to open up at the time. I've helped to build street-based mobile health programs, providing co-occurring physical health, substance use, mental health, case management services to individuals in a on the streets capacity. Had the opportunity to build and deploy a non-clinical overnight crisis intervention de-escalation team that worked closely with law enforcement.
Yes.
And I'm currently I was also the program director for an OTP and opiate treatment program, a methadone clinic. And now I'm a clinical supervisor for a nonprofit organization providing substance use disorder supervision in a blended co-occurring program. So I've done a little bit of everything
Yes.
inside the spectrum, and I've had the great fortune of working with a really diverse provider population, everything from the first iterations of peer support specialists to PsyDs, street level uh, prescribers, like individuals that had were nurse practitioners that were willing to go out with a team and provide medication access services in the community. Uh, it's been a wild ride, and it's definitely shown me some things. It's been cool.
Mike, when I consider our relationship and the way that I experience you, um, you're one of those um, very special street philosopher types where in the city, you know all the great places to eat, the places at those, the people at those restaurants know you. They know and observe your work all the time as you engage people in the city, providing them supports and services. Like the heartbeat and the pulse of this particular domain. And when anybody says, "Who knows how things work around here?" the answer is always Mike Delay. Go see Mike Delay, and he'll tell you. I've always experienced you as someone who, like an apostle, a biblical apostle, you have such command of the subject matter that you come from, and you drip when you speak such credibility. So I'm really excited to share that with others today as we discuss a topic that's very timely. It's on our information feeds, our social feeds, as people become more and more expressive and animated about the challenges of human services. And that is the dilemmas that we are experiencing in agencies with workforce. We have big challenges now with workforce churn, moral injury, burnout. I think the problem sets are becoming more and more complex as the technology advances in how we engage one another as human beings. And it's presenting leaders with extraordinary generations too. Um, Younger people are presenting different needs and different circumstances to the conventional, let's say, employment ideas and frameworks that we use as leaders. We have a rapidly changing landscape, and you have impressed me with some of your ideas on how to address that. And there are some specific areas where you've given great thought, uh, particularly when it comes to addressing or observing and talking about, I think, what you refer to as the dual track perception. There are competing tracks in organizations, that I think that might be a great place to start the discussion. Um,
Yeah.
so I'll leave it there and just simply say that, no pressure, but we're waiting for your sage wisdom, because I think I think you have the bead on this particular problem set. And if you could elaborate a little bit, I think everyone deserves to hear it.
I appreciate it. It's much kinder than I would describe it. I would say I have a robust set of experiences because I was always too dumb to say no and just bored enough to say yes. Like anytime a silly idea came up, I was like, yeah, that sounds dumb. I'm down. Let's go. But when I think about kind of what I've observed as we've tried to either roll out significant changes or newer ideas in service delivery models that look, sound, and demonstrate um, benefit, there's always the truth that the organizations trying to do these things face a significant resource limitation, right? It's always state agencies, nonprofit behavioral health, community-based programs, and there is never enough, right? Resources are always limited.
Scarcity,
Yeah,
scarcity, scarcity,
scarcity,
scarcity. You know.
right? And it's such a struggle because you see these organizations that want to do really good work and they want to attract providers, practitioners, students, uh, new employees, right? And they cast a really wide net as a result, right? They fall into the trap of trying to be all things to all people. And as a result, oftentimes end up being nothing of meaning to anyone, not through lack of desire for that not to be true, right? But they have a field of vision that's very broad as far as, I need these people, I need these people, I need these people, and I got to hang on to these people, and I got to, rob Peter to pay Paul so I can keep the wheels spinning on these different things. And it just ends up where everything feels too thin and stretched. So the idea that I kind of kick around and I think about fairly frequently is exemplified with like a dual track, right? There's two different ways to address this issue, and neither one's better than the other. They're just different, right?
Fair
The
enough.
idea, if we're going to address this, it's with the intention of stopping the hemorrhaging, right? We want to stop losing providers, right? The national average turnover rate, like the voluntary turnover rate in all industries, 2024 to 2025 was 13%. According to NatCon, over the same period of time in behavioral health, that voluntary turnover was 30 to 40%.
Yeah, it's
And that's
obscene.
just
It's
obscene.
obscene. Yes.
Mhm. And then you think of the cost associated with that turnover, right? 1.5 to 2 times the wage or salary to replace an individual, right? So it's your hemorrhaging losses. And what pops out in the research is, the primary departure reasons are lack of career advancement,
Yep.
misalignment of expectations. So when you're talking about moral injury, misalignment of expectations between the employer and the employee play into that. We have poor administrative infrastructure, a lack of meaningful supervision, and then low wages. So we talk a lot about the income potential, but it's not always the primary reason, or it's not always, the primary driver for why
Yeah.
people choose to leave the field.
Mike, in fact, the research on job satisfaction very often ranks compensation much lower than
Mhm.
mastery, autonomy, and purpose.
Yeah. Yeah. And that's really, I think, the driving factors. I can maybe count on one hand the number of people I know who got into this field for the income, right? Or the income potential.
Yeah.
We are, by the nature of what we do, a group of people who are really interested in being helpful, right? We are helping professionals. Um, but that shouldn't come at the expense of the person. And I don't think that there's a lot of intention for that to happen, but it's just, as a nature of the struggle, kind of ends up being a byproduct.
Yeah,
The
it's happening,
feelings.
right? Whether or not
Yeah.
it's the intention, it's happening.
Yeah.
And um, you have a unique worldview on two ways out of that problem that I think is so useful for people to hear.
Yeah. So like one of those tracks is and this, to kind of preface it all requires organizational intentionality, right? So clarity and vision creates clarity and execution. An organization has to decide, hey, we are going to be this and focus on whatever this is. And one of those things can be a training ground or a skill building pipeline, right? The core philosophy being we openly acknowledge that this is a high churn environment for direct service staff who are collecting hours and skills, oftentimes towards full licensure or to move on into private practice, right? And this requires upfront honesty in recruitment, right? Telling people there's going to be high caseloads, it's going to be intense work, there's going to be challenging clientele. The piece that adds to that is there the organization has a heavy investment in supervision, right? So supervisors receive higher than average pay, rigorous training funded by the organization, and have training autonomy, right? They get to set the standard for staff to be trained to and identify the key skills and ability that they want to impart to staff. So the lower entry pay for initial employees, right, gets offset by an earn while you learn value proposition. And the outcome is staff gain marketable skills and move on. The idea being that they're moving on to something better. I had the good fortune to work under a CEO when I first started, and his statement was always lose people to positive attrition. If we're losing people to lateral moves or they're leaving the field, it's because we're doing something wrong, right? If we're doing it right, they're always leaving for something better.
Mike, I got to get this in.
Yeah.
Human resources departments, I hope you're taking notes. Healthcare authorities that have regulatory oversight over the training and standards to which their contracting agencies must ascribe, I hope you're taking notes. What we've been doing is creating challenges for the agencies that really want to do better, and Mike is presenting a real possibility here in adjusting or modifying what we're going to commit to in this line of work by virtue of identity. In other words, bring it all out front. We are a high churn, high experience gathering entity. That's our identity. Our employees feel pressure, but they are invariably able to move on to better careers for them as a product of their experience here. And the reason the experience is this way here is because we are resource scarce. We have to invest in something good. So it's going to be that the quality of your experience here is so high that our people are served well, our employees understand the playing field before they come in, and these people leave here moving vertically with the positive experience they had here. I love what you're laying down.
Yeah. Well, and your supervisors or your clinical program managers become the core, the stable core of the department or organization, right?
Right.
They hold the culture, they hold the expectation, they hold the standard. And the turnover in the direct service provider population becomes factored in, right? And to click into something you just said about having with the HR departments, making sure that your recruiters are on board and skilled up in having these conversations makes all the difference. I cannot tell you what a difference it has been working with an HR department that had incredibly skilled, adaptable, honest recruiters made in staffing some really challenging programs.
Mike, I can't think of healthcare as a separate experience from what you're laying down. Teaching hospitals that are very interested in uh, giving people experience because of their busy EDs. In other words, like a teaching clinic offers that in the healthcare space. You're not going to make, you're not going to be able to buy a Ferrari working here, but you're going to gain so much meaningful and valuable experience that you'll be able to buy a Ferrari later if that's important to you at some other employer. But while you're here, here's our value proposition.
Exactly, right? You are going to, and there's no way to sugarcoat it, like to an extent, you are going to suffer.
Yes,
right?
that's the word. Yes.
Right. You are going to suffer because the work is hard, the hours are grueling, the staff conditions are challenging, right? But the work is meaningful, and you're not just out there flailing in the wilderness. There was a time where the training methodology that I ascribed to was flail, not fail. And that was a really important lesson to move away from, because that's not giving people the opportunity to excel. And that was a deficit in my leadership that I had to address and acknowledge. And now if you have the ability to really not only focus on your supervisors and clinical managers to have them have really high expectations of their staff, but to have high expectations for them as well.
Yeah.
Provide them the opportunities to attend cutting edge trainings, secure certifications so they can impart knowledge to the staff, make them a cadre that is valuable for new practitioners to listen and engage with, and then give them the autonomy to provide as much or as little supervision as necessary and set the standards for clinical engagement, right? So there's a certain amount of control that has to be handed over to the individuals that you entrust in these positions. So you pay a little bit better than average. You give them intense meaning in the work, right? Because
Yep.
I can think of very few supervisors I've known that didn't want to provide clinical insight, skill building, practice, and knowledge transmission to the folks that they supervised, and would rather sit in an office and just shuffle paperwork all day, right? Like that's not what most of them want to do. They want to be uh, information sources. They want to
Yeah.
be part of the clinical development process. So there has the organization has to be okay with providing them a level of autonomy that may be uncomfortable, um, but that's how you end up with high quality staff that are going to stay with the organization and continue to provide you this pipeline of, you know, uh, skill deficit individuals turning into skilled practitioners relatively quickly and then moving on somewhere. You build a reputation, you build a brand. It increases the likelihood of that pipeline staying full because people want to come and achieve that
Yeah.
knowledge level.
Yeah. Mike, there are clinics that have that waiting list.
Mhm.
I'll reveal this in this discussion. It's impossible for me to not think about my cousin's experience on her way to her pharmacological doctorate.
Mhm.
She did a internship at Mayo and became part of the cadre as an offering because of her high performance experience at the clinic. And then even that was demanding enough where she eventually departed the cadre and is now the director of pharmacology at a very large hospital system. But it was
Yeah.
because she suffered at Mayo with meaningful training, meaningful investment in her, and and otherworldly experience. People come to Mayo for care from all over the world.
Yeah.
Members of the royal family, um, heads of state come to Mayo because the best is there. And it doesn't mean that everybody is paid the best, but they have created a culture where the best is available to you there whenever you go.
Yeah. Yeah. And that's really the thing is generating benefit. So if you have limited resources, how do you generate the greatest benefit, first of all, to the clients that we seek to serve
Yeah.
and to the workforce, right? And again, this is a high churn environment. It doesn't have to be as high churn as it is. And part of that is providing value and
Yeah.
providing honesty at the inception, right? Because if you're open about these challenges prior to somebody coming in, not only does it set the table, bring you in a certain type of applicant, it also prevents staff conflict, right? So if they
Oh,
start
yes.
struggling with the workload or they start struggling with the culture of the environment, you really have an ability to have open and honest dialogue being like, we were upfront about what this was going to be before you started. We clearly laid out an expectation of what the work challenges were going to be, the expectations were going to be. So here we are. How do you want to resolve this? Is this a
Oh,
good fit for you? Or is this something that you can address internally and meet the expectations so you can benefit in the long run? Right? It
Mike,
changes the way you have those conversations.
I couldn't agree more. Our videographer, he has this phrase that he says all the time. I love it. It's called "The secret is clear." And that you're kind of revealing how clear the secret is. This is the secret. I can't tell you how many systems we engage where in the course of our training or consultation, it will be revealed by more than one person, one of the fundamental observations that they make in whether it's human services, or let's say with some more specificity, the detention environment, whether that be inpatient psychiatric admissions, juvenile detention, or adult corrections, any of those, here's the same problem that shows up no matter what in every single one of these places we have been. More than one person will say, we have these recruitment events. We offer signing bonuses, but the word is out. What's being sold is not what is after we get in there. And people are leaving because the bill of goods that they have been sold about the meaningfulness of the work and the opportunities for advancement and compensation and deriving value. I'm going into Fallujah. It's Fallujah in there. It's not anything that these people said. I'm going to go work someplace else. Mike,
Yeah.
every single system we have worked with, there are people in it who report that.
Yeah. And I think that it is a natural reaction that systems have, which is the fear of being upfront,
Right.
right? Being upfront about the challenges that the workforce is going to face, or being upfront about the challenges of doing the actual work, because they don't want to scare away possible applicants. And it's like, I hear that, and I actually understand it to a great degree, right? You want to get people in the door, you want them to
Right.
find something that's meaningful to them that'll keep them there, even though
Right. You
things are
don't want to
challenging.
say it, this place is a meat grinder. You don't want to say that. Yeah, we get it.
As opposed to, is it going to be harder to recruit? Possibly. But if you're upfront and you're doing realistic job expectations, if you're doing realistic day in the life explanations, or doing realistic video tours, right? You're going to see a reduction in churn from the people who do onboard as a result of having that up front.
Oh, I couldn't be more aligned with you. That you're going to get a different applicant. You're
Yeah.
going to get someone who's clear about the challenge. I want the experience. I
Mhm.
want this, and I'm ready to endure. I'm already getting prepared to endure the challenges of the work environment. And
Yeah.
then they go through an onboarding process that properly prepares them, hopefully.
And you get an opportunity to brag as an institution. You look at the people who have passed through your system
Yeah,
and go on to do other things and be like, yeah, it's going to be tough. It's going to be a meat grinder. Individuals who spend a certain amount of time in our system go on to be road deputies. They go on to
right.
be, transition into different fields of operation that are adjacent with a level of proficiency that most applicants for those positions don't have. Like, as a supervisor, my favorite thing is when I see people that I've had the good fortune to supervise go on and do incredible things that I couldn't even think of as being possible, right? But it's because you give them the opportunity to knock your socks off,
Yeah.
right? You give them every opportunity to be better than you, right? You invest in the option of like, I'm going to throw this person every single thing that I have available in me, with the idea that they're going to take that and use it as rocket fuel to go and be bigger, better, badder than I could ever be. And if that's your pipeline, right? If that's your institutional intention, you start attracting individuals who want that want to
Oh,
see this as the opportunity. And this is
truth,
just one
truth.
channel, right? So this is
Yes.
just one, but it starts with intention. So you intentionally frame the system to operate in this fashion. And anything that falls outside of it, you jettison, because it starts becoming a resource suck. It muddies the message, it changes the mission. And you start to get some fragmentation in the target objectives. If you can avoid that and really stay focused on, we want to be, like you're talking about with the Mayo Clinic, we want to be a training site. We want to be a place that people spend 3 or 4 years in, honing their craft, becoming exceptional, and moving on to really incredible things. then that's who you attract, is
Yes.
people who
Oh,
want to be a part of that, right?
Mike, you have some thoughts that are worth articulating on the acceptance of resource scarcity. In other words,
Yeah.
accepting and truly living into this idea. You describe it as, yeah, there's never enough, and there's never going to be enough. There's in this work. If you could elaborate on that a little bit more, it kind of like
Yeah.
accepting the collateral existential reality
Yeah.
of this work. If you could elaborate on that, I think people would love to hear that.
So resources are always limited in behavioral health in any state, federal, county funded organization, right? Organizations that pick one channel, communicate it honestly, and commit fully to create clear expectations, strong culture, and um, lower churn, they end up with lower conflict. Trying to straddle both or all creates a bait and switch that helps to drive turnover. We can't afford to be all things to all people. Mixed strategies waste resources and they erode trust. And that's hard to admit sometimes, right? We
Yeah.
don't want to be seen as low trust employers, or we don't want to be seen as low trust service providers because we're trying to meet too many needs internally when there's never enough need, or there's never enough resources to meet the external needs of the service population,
Yep.
right? That's always going to be the challenge. And there has to be a very stark realization that how you deploy resources needs to be targeted, efficient, and effective, right? It needs to meet your specific goal set, and your goal set can't be everything.
Right. Predefined. And
Yep.
that's that's a gem that you just said. The goal set cannot be everything. It can't be, we are going to be all things to all people, that we
Mhm.
might by all means save some, as St. Paul would say. And there has to be some intentionality and focus on what the hell the values are going to be.
Yeah.
They're going to be here. Mike, and you may have some more thoughts on this, but I'm consuming, I eat a lot of toothpicks when we talk because I'm always thinking, and I can't smoke my pipe in here. So apologies, to the viewers for witnessing me, with these fidgety things.
I have
Um,
my fidget sick, so like
yeah.
I'm right there with you, brother. Yeah.
Mike, what do you say to the employees who are resonating with this? They're in there
Mhm.
saying, yeah, man, we wish it was that way. What do
Mhm.
you say to them right now when they're in there? They're experiencing a desire for a culture like you've described, but there's maybe some despair or there's
Yeah.
some disbelief. We could never be that here. What do you say to those workforce members that are in need of support?
Be the change you want to see, right? Which is kind of cold in a certain sense. Um, Speaking your need in a collaborative, collegial, targeted fashion, and finding others inside your system that share that value. If as direct service providers, we can come together directly, articulate what is really important to us in a non-confrontational, collaborative fashion, and make clear asks for this level of focus, attention, and support, I think the chances of that need being met are much greater. And you may also have the unfortunate experience where you're inside of a system that is unwilling to make the changes necessary, and that's okay, right? Systems have a right to exist and
Be
run
what
the
they
way that
are.
they want to run, right?
Yeah.
But you're under no obligation to remain inside that system. I would always encourage people, never be a slave to the work because you love it. Be committed to the mission and find the place that most closely matches your drive.
Oh, what a gem that is, Mike, because how often have we seen people resigned to the idea that they must suffer, that they can't leave, and that they have to accept the natural bitterness that they know is going to develop on an unfulfilled hope for change.
Mm-hmm.
They don't need to stay there. Um, that's not discouragement. That's in the service of one's personal wellness. I have never seen someone toil in this line of work in a system that doesn't change without long-standing negative emotion impacts, or they've somehow resolved it. They've
Yeah.
resolved it personally where they accept, I'm not going to change this thing. I'm going to at least determine, self-determine who I am. I am going to release any expectations on myself about changing this thing externally, and I'm
Mm-hmm.
just going to be the best person I can to earn my way through this. Those
What?
people, they can do that. They're in the minority. The majority, I think, are people who have been there for 15, 20, and 25 years, and by the end of their career, they're they're bitter. They're writing books about the problems to avoid in this career field. And
Mm-hmm.
for instance, in the corrections environment, the average lifespan of the career correctional employee is 58 years old.
2 years past retirement.
Yeah,
Yep. Yeah. To that point, and like, yes, I hear that. And then to just offer an
please.
anecdotal antithesis, right? One of the most empowering moments that I ever had, one of the coolest moments that I've had as a supervisor. I had a supervisee, and they were great. They were really good at their job, right? They were driven, passionate, motivated, right?
Sure.
And they flat out said, like, I don't like the way you supervise. It's
Oh,
like, cool, right? Here's what I did, right? These are the check boxes that got me into a position where I could do this, right? What do you want to do with that? And they're like, great, thank you for the checklist. They went out and did them. They left and became a supervisor somewhere else. And they saw a need in the system, right? Embodied by me, right? I was the unmet need because I was, they didn't like my style, which is great. I mean, I'm not fit for consumption in a lot of situations. Um, but they became an amazing supervisor because they saw, I don't like this. I think I can do this better. Awesome. Here's how you do this, right? Here's how you meet the expectation so that you can submit a resume and you can have this job. Like, go do it.
yeah.
And they did. And they're thriving. And now, so they get the opportunity to go and be what they saw as filling the need. And that's, I think, the most empowering thing to me is helping people realize that they're not as stuck as they think they are.
Oh, I
They're
love
not.
that, Mike. Yes, I love that. I love that. People are not as stuck as they think they are.
Yeah.
And um, what would you say what are your recommendations to someone who feels stuck? I feel
Yeah.
stuck. What would you ask them to consider, explore? What would you invite them to do to further inform their view that they're stuck? And I will qualify that with this comment.
Mhm.
There are some people that want to be stuck. There are
Sure.
some people that just want the, let's say, simplicity of avoiding discomfort by believing that they're so stuck that to lean into discomfort is so undesirable that I will accept being stuck over that. There,
Yeah.
there is a cohort of those people, but with the exception of those people, what would you say to someone who's thinking they're stuck? What would you invite them to do, recommend them to do?
It's usually like I lean into, generally speaking, like motivational interviewing and the Socratic method, right? Like,
Yes.
why do you feel stuck? What is it that's making you stick? Right? Like, well, sometimes it's I gotta hit my 20 so I can get my pension. Like, okay, heard. Is this the only place or the only system that you can meet that 20-year requirement? Are there other opportunities? Are there other options that would allow you to stay vested in PERS or, stay connected to a system that's going to support the reduction in student loans? Right? Or is this just the most comfortable one? Have you explored what your actual options are?
Oh, yes, yes.
What is it that makes you come here despite feeling like it sucks? Right? What is it like? Let's ignore for a second, like we've identified that there's all these horrible things, there's all these things that you really hate, right? What are the things that you actually enjoy about this work? Or what are the things you wish you could enjoy more about this work? Okay. Get that list going. Great. How do we go about finding those in the community or finding those in the area that it's maybe more of a focus, right? Where is it that you might be more in alignment? Because people get comfortable in systems. They know the routine, they know the people, and rather than leaving the system, they want to try to change the system. And that's
Yes.
admirable to an extent, right? Little David and Goliath action, which, like
Yeah.
I'm dumb enough to pick that fight on a regular basis. I've lost it a lot of times, and like, I'll
Me
still pick up
too.
my
Yeah.
sling. Yeah. But you don't have to, right? It's a choice to. And it's usually a choice driven by a desire to be comfortable while you create discomfort,
Yeah.
as opposed to, can I be uncomfortable enough to find some place that will be a better fit for me and I might be a better fit for? What is the actual downside? And in that self-reflection process, sometimes what you find is, I really can't leave. I really can't make this transition. This is the only place. Okay. So banging your head against the wall hasn't worked out super well. That looks fairly painful. You want to keep that up, or do you want to try something different? Right? And it reframes the conversation of, rather than, fighting for what they see as a moral right or an amoral system, it becomes, what accommodations can you make so that you are the healthiest, most present, robust, and fulfilling version of yourself possible while you do this thing? And what is it outside of life or outside of this particular thing in your life that you can find fulfillment in to offset the deficits in the workplace? Because if you're making the choice not to leave and you're going to stay, okay. If the workplace isn't going to change to meet your perceived needs, okay. What changes can you make in the life you lead to reduce the injury or reduce the suffering that you experience while on the clock?
Mm. You're like going to a ministerial counseling session. Um, Mike, you're really leveraging exactly what you said, motivational interviewing and the Socratic method. How do supervisors, you're proffering really needed ideas to be implemented within a workforce of supervisors that either may not know that kind of um, subject matter would be useful to them,
Mm-hmm.
uh, or let's say someone has been inspired as a result of your message and they want to know how to learn more about what you're laying down. Where would you tell them to go to learn more about this idea that you're leveraging here, where you're asking open-ended questions of someone to invite their own critical thinking to solve their own problem? Where does one learn how to get good at that?
The first place to go is internal, right? Like if you exist in a supervisory role, and this is not just behavioral health, this is supervisory role in any kind of system where people interact with each other, right? Maybe
Yeah.
a little less like a supervisor in a machine shop, but I've seen it work there as well. But the first thing is get good. Like figure out what you like about what you do and the field you're in, and attain subject matter mastery. Like really invest in
In
your
the thing.
own, in
Yeah.
the thing, whatever the thing is, right? It
Right.
could
In the
be,
thing.
yeah, like it could be, DBT, it could be Gestalt, I don't care, right? Like find the thing that you love most and then become somebody worth listening to, right?
Oh, I love it.
And
Mike,
then, yeah,
but don't leave out, where does someone learn more about the motivational interviewing method? I should have just asked that specifically. That's what
there's
I
so
was
many,
intending. But
there's so many different
elaborate
ways
on
to
that.
do it. There's like the different states offer motivational interviewing trainings through, I've seen them come through the HCA, I've seen them come through DBHR. There's specific motivational interviewing trainings. My organization, I was fortunate enough where the agency actually brought in an MI specialist that provided these services in a 3-day training. It wasn't just like read the MI book, write some papers on it like you might experience in class, but it's like
Right.
look, and it's hard to say this one place, right? Because
Fair enough. That's fine. But you're
there's 6,000 ways to learn the methodology. Explore and find one that seems to fit for you, because I mean that's the beautiful thing about MI is it's a schema and it's a theoretical construct, and there's 7 million different ways to deploy it, which means
yes.
there's just as many ways to train it. So it really comes down to finding a trainer or a training consortium that fits your value set and how you view the material.
So often, Mike, people, um, as I was, so often, Mike, organizations pursue motivational interviewing training for the direct service workforce to engage people served. We're not
Sure.
discussing it in that context. We're discussing it in the supervisory context
Mhm.
between the supervisor and the specific problem set of job dissatisfaction with a
Yeah.
subordinate employee who is in the direct service role. And,
Yes.
and I'm not saying it doesn't exist. I'm not aware of MI training that is branded or packaged for that
Mhm.
particular cohort. And while
I,
I'm
I
sure
don't
that
know if
there
there
is, I just
is.
haven't seen it. Yeah.
Yeah, I haven't either. I think it's one of those things where it's you become adept enough at it, or you understand and internalize it enough where you can deploy it in any environment. It's like nonviolent communication skills. Like
Yeah. Completely.
nonviolent communication skills, crisis intervention, de-escalation skills are healthy communication skills. And you
Yes.
don't have to wait for specific
Right.
instances to use
Context.
them.
This only
Yeah.
works when we have to get kids to go to bed. Listening
Yeah.
to you describe the kind of curiosity to lead someone to greater optimism and direction and personal agency is precisely the method that Tony Blauer describes in managing fear.
Mhm.
You have without even let's say, and I know Tony and Tony's work, but without even intending to do so, you have described knowing fear.
Yeah.
And the way to resolve fear is by leaning into duress and engaging in curiosity and Socratic questioning. Alex Honnold just described that that's his own method when
Yeah.
dealing with free climbing problems that could result in his own death. That's
Yeah.
how he deals with fear.
Mhm. And I'd love to say that this is some magic thing that I came up with, like through the course of my years in the field,
Yes.
I have found this is how my supervisor engaged with me.
Yeah.
Like, and I've been blessed through the years to have some absolutely phenomenal supervisors. Like I
Yeah.
have had the great pleasure of learning from some incredible human beings. And this is how they engaged with me and gave me maybe to their detriment at times. The autonomy to explore internally, what does this mean to me? And is what I'm doing actually the right thing for me? And
Oh,
if it's not, how do I change that? And what does changing that look like? And they didn't shy away from having, there's like, you're not talking about client care. I don't want to talk about that. Right. They didn't shy away from it. It didn't become therapeutic. It wasn't like having some
right.
kind of therapeutic relationship. It was a developmental discovery, which allowed me to increase my professionalism, increase the quality of care I was providing, and learn what it is that I love about the work. So that as I advanced through my profession, I could really clearly articulate what it is that I love about this and share that with people. And not every supervisee I've had shared that passion for those specific things, but there was always something. So
Yeah.
helping them really key into that and then determine, is that thing I'm passionate about valuable enough to offset the costs of the suffering that this work by its very nature
Oh my
creates?
gosh, what a way to wrap it all up. Mike, you unintentionally just helped me resolve a dilemma I'm dealing with in my personal life right now in another thing that I do um, as an elected official. But there is absolutely something to be said about reconnecting with why, and allow that to motivate and shape your decisions and tolerance thresholds for bullshit. And
Yep.
um, you know, uh, I'm so grateful to you. I'm so grateful to you and humbled by the way that you articulate yourself. I truly believe that what you have laid down here today, um, it needs to be heard and experienced by our viewers. Mike, final thoughts, um, recommendations, encouragement, um, maybe some follow up on how people can get in touch with you. Final
Yeah.
thoughts that capture all those things.
I'm just a lizard on a rock doing the thing, man. Like, it's just, it is what it, like, life legitimately is what it is. The realities of life, our work, the state of the profession simply is, right? It's neither good nor bad. It's just what it is. We have the autonomy to decide what we want to do with that reality, that truth. We have, as individuals, the autonomy to explore what that means for us and then make a decision, as opposed to being reactive or being uh, automatically conflict oriented when we're faced with these challenges. We can, by nature of our humanness, step back and explore what the meaning of these realities are to us, and then make choices as opposed to feeling constantly forced or constantly driven. We can oftentimes make more choices than we give ourselves credit for
Yeah.
because we don't always give ourselves the space to make that choice
Yep.
because we feel so
Everybody is their
pressured.
own first responder,
Yeah, exactly.
you know?
And like, I'm on LinkedIn variably. Probably the best way to get in touch with me is through you. I don't exist in the digital space very much,
Yeah, if
but I'm
you're
around.
interested in learning
Yeah,
more about Mike Delay and his work and his wise counsel, you can email us at info@hopereform.org and we'll hook you up with Mike.
yeah,
You can also visit my LinkedIn page, Andy Prisco on LinkedIn. Mike Delay has a LinkedIn page. We're always engaging in some kind of public discourse about this or that and sharing one another's posts.
yeah.
Um, Mike, thank you for the force you are in the world and for the just wonderfully gentle, wise counsel that, clearly is something that has been hard earned in your professional life. And thank you for the giftedness that you demonstrate in articulating that to others to serve others in the space. It's greatly appreciated.
You're far too kind, man. I appreciate the kind words and the opportunity to have this conversation. It's a great organization that you've got here and what you're doing with this conference is incredibly important and timely. So thank
Thank
you.
you.
Appreciate it, man.
If you've consumed this on YouTube, which I believe for this conference is the primary platform, please like and subscribe the Hope Reform channel. Please share this video with others that you feel it might be helpful for them to consume. Please consider visiting hopereform.org and making a donation to our organization. It is a nonprofit and a 501c3 charity where we offer technical assistance, certification, and accreditation for agencies delivering crisis services. Thank you for your time and support of the work we do at Hope Reform. And thank you again, Mike Delay, for being here. Be well, all, and take
My
good care.
pleasure.